So let's start with Borrelia burgdorferi, otherwise known as Lyme disease. Not limes. Oftentimes people say Lyme apostrophe S. It's just Lyme, as in Lyme, Connecticut. So please mark all the symptoms that you have. So fatigue. And then these are really the cardinal signs. So symptoms that come and go. So you've got good days and you have bad days, and they're really dramatic. And then symptoms that move around the body. So you can have joint pain, muscle pain, or nerve pain that moves around the body, really depending on the moment or depending on the day. So if one day you've got elbow pain that's really bad, and the next day you have wrist pain, it's kind of moving around the body, and some days are good and some days aren't good, then that's really characteristic and pathognomonic, almost diagnostic for Borrelia burgdorferi. You can also get a rash, and it can be worse around your menses. So doing that DNAconnections.com Lyme panel urine PCR test with the provocation that we talked about really is the best test. And that provocation, just as a reminder, the lymph massage or 30 minutes of exercise, what it's doing is you're pushing all of those bugs out of the lymph system into the bloodstream so that it can be collected in the urine. And it's good to actually do this provocation as well before you do the blood test, the multiple pathogen blood test through Cyrex as well. Good, because you're going to get more of a chance of getting a positive response, which is really what we're looking for, because these bugs really love to hide. And we really want that direction. So the laboratory data is the presence of Borrelia on urine PCR testing and education. In my experience, it's very likely that someone has a Borrelia infection if they have both of the asterisk symptoms above. This can be confirmed with the urine PCR test, but is not entirely necessary. So even the Centers for Disease Control in Atlanta talk about these infections as being clinical diagnoses. So they are more based off of the symptoms that you have and the signs that you have instead of a lab test. And a lot of that has to do with the fact that the Western blot test, which is the immunoglobulin test for these infections, was really for epidemiologic studies only. It wasn't for diagnosis, it was just for research. So pay closer attention to the symptoms, and then the urine PCR test is going to be confirmatory. So make your determination.